Welcome everyone to today's episode where we're going to discuss a very important and sensitive topic, the effects of abortion on both the mother and the preborn baby. I'm Philippa.
And I'm Diane. We want to shed light on the issue from a medical, ethical, and emotional perspective. It is a complex topic that affects many lives. And today, we aim to explore it with facts and compassion.
We hope today's discussion will help our listeners understand not just the physical effects, but also the profound emotional and long-term consequences involved. I'm Tariq, and let's dive in.
To start, let's define abortion. It's important to understand the meaning of words. Some persons may have heard that abortion is the termination of pregnancy before the fetus is viable, meaning before the baby can survive outside the womb, usually around 23 to 24 weeks. This is not an accurate definition. Here's the thing. All pregnancies terminate, usually around 9 months. There is either termination with the birth of a live baby or termination with the delivery of a dead baby. Stillbirth and miscarriages are where the body has determined that the pregnancy cannot continue or complications have developed within the womb or the mother's body itself, and this causes the baby to die. An abortion, however, is the deliberate termination of a human pregnancy by medical or surgical methods which have as their desired objective the death of the fetus or embryo in the mother's womb and his or her subsequent removal from the womb. This is a definition provided by Dr. Doreen Brady-West, a Jamaican oncologist and ethicist.
The methods and timing of carrying out abortions do vary, and today we'll look at some of those.
There are several procedures, like vacuum aspiration, applied to the fetus at 14 weeks of age. It involves dismembering the fetus with a suction to remove it from the womb. Dilation and evacuation is a similar procedure of dismemberment at the stage of the second trimester.
Late-term abortion refers to an abortion after the fetus has passed 24 weeks of gestation. The baby is fully formed at that stage. This procedure involves injecting chemicals to stop the baby's heartbeat, followed by removal from the womb. These procedures are highly risky, even for skilled surgeons, and carry serious implications for the mother's physical health.
That's right, Diane. This is so important to understand that regardless of the method, there is no such thing as a safe abortion.
Let's discuss how abortion impacts the mother. Now, Dr. Cherie Simpson, a general practitioner right here in Jamaica, has explained that the uterus is designed as a nurturing environment for a developing baby. Therefore, removing the baby prematurely and forcibly, as in an abortion, can cause damage.
She mentions that abortion procedures complication can include severe bleeding, infections, perforation of the womb, and even pieces of dismembered baby remaining in the womb, which can lead to life-threatening infections.
Statistically, the risk of death for the mother from abortion increases by 38% for every week after 8 weeks of gestation. In Canada, statistics show that about 10% of abortions have immediate complications for the mother, such as bleeding or perforations.
And then there are long-term effects for the mothers, and some of these long-term effects include infertility, with 66% of women experiencing problems in getting pregnant again. There's also an increased risk of cervical cancer and breast cancer, with studies indicating women who have had abortions are 3 times more likely to develop breast cancer.
Wow.
The emotional toll is also very profound. Studies from the UK show that 80% of women who had abortions feel guilt. 83% of women regretted their decision, and many suffered from depression, anxiety, sleep problems, and even suicidal thoughts months after the procedure.
Finland's data is alarming too, showing a 650% increase in suicidal risk among women post-abortion. It's clear that the psychological effects are severe and long-lasting.
Well, these statistics are really alarming. Now, let's look at the baby, the preborn child. The effects are tragically tragic because abortion is intended to kill the baby. And it's false to think that babies don't feel pain. Depending on the stage of pregnancy, babies being aborted experience a painful death. The fetus can feel pain and pleasure between 10 to 13 weeks of age.
That's right, Filippo. It's really heartbreaking to think of the pain and suffering involved. No matter the method, the outcome is a loss of a life.
Yes.
A life that, at certain stages, could survive outside the womb.
And there's also the moral and ethical debate surrounding abortion. But from a medical standpoint, the physical and emotional consequences for the mother are significant and often underestimated.
Absolutely. And it is crucial for women to be fully informed of these risks before making such a life-altering decision.
Yes, it is. Well, to wrap up, we want to remind everyone that whether you support or oppose abortion, understanding the facts about its effects on mothers and babies is vital. It's a topic that touches on health, ethics, and compassion.
Well, thank you for joining us today. We hope that this discussion has provided clarity and insight. Remember, every life is precious, and every woman deserves support and care.
Until next time, take care and keep seeking the truth.